Welcome, ladies and gentlemen, to the Global Health webinar for today, organized by the National University of Singapore, the Salisbury House School of Public Health. With your permission, we'll just wait another minute or two for just a few more attendees to come by, and then we'll get started just about 2 minutes past the hour. Ladies and gentlemen, why don't we get started? As a brief introduction to everyone, my name is Swee King, and I'm a physician from Malaysia, and I spent about 6 years working with refugees. But that 6 years for working with refugees really pales into comparison with the 3 speakers that we have today, and I'll introduce them very briefly in turn just before they're about to speak. But between Dr. Tiah Ling, Dr. Lim Chin Siah, and Dr. Hakim Young, they spent about 30 years in total, as I calculated, in Afghanistan, the country which is a topic for our conversation today. The theme or the topic for today is the Afghanistan reality on the ground, post-Taliban, and also the Singapore community response to it. Just to set the scene for everyone, Afghanistan is a country of approximately 40 million people with a GDP per capita of approximately $500. This contrasts obviously to relatively smaller and more prosperous Singapore, and the return to power of the Taliban in the late last year in 2021 obviously has heralded a period of uncertainty, instability, conflict, violence, and many other pretty sad terms that we can use to describe the situation in the country right now. But there are some bright spots. And inside the bright spots in Afghanistan over the last few years, and certainly ongoing, are the courage of the healthcare practitioners who go to Afghanistan to support the people in Afghanistan. And today we have 3 of them to share their experiences and also to take questions from you shortly. Ladies and gentlemen, that's my brief introduction, just to set the stage for today's conversation about the Afghanistan realities on the ground today. Our first speaker is Dr. Tiah Ling. Tiah Ling, if I may, is an emergency medicine consultant practicing in Singapore since 2006 in Changi Hospital, and she's currently a senior consultant in the A&E, or the Accident Emergency Department, also in Changi. In 2008, she received a scholarship from the NMRC, the National Medical Research Council, to go to Johns Hopkins, where she did training in emergency medicine and also in the Bloomberg School of Public Health. Upon returning to Singapore in 2010, Tiah Ling continued her work in public health in Cambodia in 2011 to 14. She helped support hospital management development, meaning helping hospitals just develop their capacity for management in Afghanistan in 2014, in Laos in 15, and in Myanmar in 2021. So I'm very pleased to introduce Dr. Tiah Ling and cede the floor to her for her to share her thoughts to us about insights and voices from the field and evaluation of hospital services in Afghanistan. Tiah Ling, if I may, the floor is yours.
Thank you very much, Siki, for the very generous introduction. And welcome everybody here. Thank you for spending your afternoon with us. If I may just jump straight into the sharing. Okay, can see the slides, yeah? All right, okay, Ken. So this is the topic that I will share today. Essentially, it is a sharing of my personal experience long time ago, actually, but I think it's still very relevant to the topic and what is going on in Afghanistan today, right? So this is how I sort of organized the story. So it's the beginning is a little bit about how I got involved, and then the context of what I was doing, and then what we did in the field, and then our findings from our what we did from our evaluation. Okay. So very briefly, as was mentioned, I was fortunate enough to be part of this International Emergency Medicine Fellowship Program, and this was a joint joint collaboration program with Johns Hopkins and their Department of Emergency Medicine. So if you realize, this was in my younger days, like 2008 to 2010. So this is where all these, that was when all my experience took place. So in the 2 years that I was there, I had the opportunity to complete a Master's of Public Health. And then the other part of the time was spent in field work, both in Africa and in certain parts of Asia, including Afghanistan. Then just to set the context of what the setting was when I got myself into the situation, this is a very simplified framework for healthcare services in Afghanistan during that time. So they sort of organized it by levels of catchment area, from the community village level all the way to regional national level. And correspondingly to each level, there are health facilities that is supporting the community at that level. So the different types of health facilities, and they can roughly be categorized or grouped into what we know as primary healthcare, secondary healthcare, and tertiary healthcare. And at that time, the Ministry of Public Health of Afghanistan actually came up with two packages for healthcare. The first one is the basic packages of health services, with a focus essentially on strengthening primary healthcare. And then the second one, the one that I'm more involved in, is the essential package for hospital services. So for the essential package of hospital services, essentially it is a sort of a policy or guideline for the community on the ground involved in healthcare management or running the healthcare facility, in the sense of the staffing needs, the drugs that they would need at what sort of level of healthcare facility they need. So it's a guideline that they have. What sort of condition they could treat at what sort of level. So it is quite a comprehensive set of guidelines, and is rolled out nationally for these healthcare facilities to follow, right? But at that time, on the ground, it's not so clear-cut. So we have some health facilities and hospitals that are delivering healthcare services according to this package. But in Singapore, we are quite clean in the sense that it's public or private in a way. So at that time in Afghanistan, it's a little bit more complex. So what we have is actually different funders, international funder to local one, and to NGOs. So the different funders are the Ministry of Public Health, World Bank, USAID, European Commission, and others. Others means private NGOs. They are the entity, they are the party who sponsor by providing the funds. And then the group that is on the ground organizing the whole healthcare delivery services are the different groups of NGOs. And there's a particular so-called Ministry of Public Health group called Hospital Reform Project group. And they are largely involved in actually implementing the services. So we can see that there's different funding support, different contract mechanisms, and then there's also variable implementation of this package throughout the country. So how was I was involved as part of Hopkins' involvement in this. So Hopkins, together with the Indian Institute of Health Management Research, undertook this MetaSharp project. The long name is there for all to see. So this MetaSharp project is essentially a 5-year evaluation project. The essential package of hospital services is sort of funded by the World Bank, and the Ministry of Public Health Afghanistan has actually commissioned the Hopkins and the Indian Institute of Health Management Research Group to actually independently assess every year the delivery of these services, the performance of the health facilities. And with this yearly assessment, the feedback is meant to strengthen the capacity of the Ministry of Public Health in their policy decision makings. So we do both quantitative and qualitative evaluations. So what I'm going to share today is a little bit just extraction from this qualitative evaluations that I have the opportunity to be involved in. So what did we do actually? So this is again a very simplified summary. So qualitative evaluation sort of a methodology. The essential aim is to identify key themes with a potential impact on your hospital services and performance through experiences of different stakeholders. So in terms of data collection, we have identified 5 hospitals selected specifically to represent the different funding mechanisms. Then we conduct in-depth interviews with the key informants together with field visits to the hospitals. And then we come back with analysis, transcripts, and then run through the analysis. We use a multi-case study approach, and each interview transcript is examined for significant phrases and statements, etc. Yeah. So the 5 hospitals are spread out in these areas. They are sort of congregated in a little bit northeast area because the other side is the security is a little bit not so stable. So we avoided there. So we actually traveled to these particular hospitals to interview the key informants. And this took place for slightly over 4 months. And the 5 hospitals that we visited, we managed to arrange for 13 interview sessions, and there were about 20 interviewers being surveyed, right? And what we have is the next few slides is going to be a bit wordy because it is essentially the results of our analysis. So I try to summarize it. The first big theme that we have is contractual issues. So essentially, one of the few things that they mentioned is the least cost proposal for the program is widely perceived as an inherent flaw in the process. So these are some of the quotations from the informants. The other problem was a short-term duration of the contract. So it's not a year-by-year or 3-year, 5-year thing. It could be as short as 3 months or 6 months. For those that are 2 years contract, some of them actually find it too short as well. So ideally, they would like to have at least a 5-year plan for more efficient strategic planning for the hospitals. So these are some of the contractual issues. The other big theme we sort of surface is in terms of technical support. So there's lack of a structured technical support. So some organizations do have their own resources that they can draw upon, but there are others who have no access at all. So again, these are some of the quotations. So some examples are, for example, drug procurement. So whether they can do it, the hospital director themselves can actually do it, or the organization helps them to do. So these are technical support. Then capacity building and autonomy. So that is a very highly rated in terms of having a more sustainable solution. Then the next one is about the guidelines. So clinical services can be a bit vague, so there are confusion on the ground. And then drug formulary might not meet the needs of selected communities. And then staffing estimation in the protocol and the policy might fall short. And of course, there's staff salary variation across different provinces. And the last thing that they have is relationships among the stakeholders. So it can range from a very good relationship to challenging, difficult encounter with the stakeholders. And the last one is a referral system. So it's largely an unstructured referral system, but it's actually because it's challenged by the geographical characteristics and social barriers to some extent, but there are potential areas for improvement. So once we get these sort of themes come out, we sort of make some recommendations based on the themes that have emerged from our analysis. And these are packaged together with the annual quantitative results evaluation that we have, and then fed back to the Ministry of Public Health for their usage, and then for them to strengthen where they need and address the gaps that they have. So that's a very, very brief summary of what I have. I'm sorry I have to skip through some of the quotations, but these slides, it can be shared like, if you do wish to have a second look at some of these quotations. Yeah, thank you very much.
Thank you, Tiah Ling, for taking us through the hospital development and hospital management and the issues surrounding that from about 10 years ago. And you mentioned something, which is that a lot of your research was seen in the, shall we say, the parts of the country that was more accessible at that time. And I think that's a great starting point for this conversation today. Let me move on to our second speaker. And if you've just joined us, we're having the conversation today about the Afghanistan reality on the ground after the Taliban and the Singapore community's response to that. But the Singapore community's response hasn't only been after the Taliban came back into power, but it's been going on for many years already. So our next speaker will tell us about what he's been doing in Afghanistan since 2013. Dr. Lim Chin Siah, or Chin Siah if I may, he's just come back to Singapore from Afghanistan just last month. And when he was in Afghanistan, he was working as the emergency room and the intensive care unit doctor in an MSF unit in a place called Boost. It was an old name, but the current name is Lashkar Gah. But you may know this as the capital city of Helmand province, and Helmand province is where some of the fiercest fighting took place. So Chin Siah is a field worker with MSF since 2013. He's been in Pakistan, Afghanistan, Yemen, Syria, and he's also been awarded the Healthcare Humanity Award by the Courage Fund in Singapore in 2016. Like I said, Chin Siah's just come back just last month. Chin Siah, we're happy to listen to your thoughts, and the floor is yours. Over to you.
Hi guys, good afternoon. Thank you, SK. Thank you everybody for attending this talk. I'll just share my screen now. Okay. Yep. All right, I'm just going to give, SK said, I just came back last month, so it's fresh in my head. I'll just share with you what I did over the past about almost 5 months in Afghanistan, in Helmand. A quick disclaimer, whatever I'm saying is on my own opinion, not necessarily from MSF itself. Also, I'd like to stress that even though I was there for quite some time, my window to whatever I've seen is only very narrow because it's a highly insecure area. I only see things through a small car window and my room window. I never go outside. I don't know what's happening outside. Basically, whatever I've seen in the hospital, this big hospital, is whatever comes through the doors to our ER. And from there, I can sort of infer or maybe sometimes assume certain things, but it's all my own opinion. It may be wrong, of course. So just my very narrow view of what I've seen and observed these few months. A quick overview of MSF activities in Afghanistan. There are 6 main projects in Afghanistan. In Kunduz, there's a trauma center. In Kabul's our coordination office. Kos, we have a large maternity hospital. Kandahar, we have malnutrition and TB treatment centers. Herat is also a malnutrition center. And I understand they're opening now a COVID-19 treatment center. And in Lashkar, that was where I was, in the province of Helmand. Helmand is about, if I understand correctly, it's about 1.5 million population. And our hospital, in Boost Hospital, is supported by MSF. We work together with the local MOPH. But I would say largely MSF has, in a way, taken over the hospital. And we work together with the local MOPH. As you all know, I was supposed to go in August, and this happened. There was intense fighting when the Taliban were trying to take over. Unfortunately, in Helmand, there was intense resistance, and our hospital was under, I wouldn't say direct fire, but in the thick of the action. And there's a rocket exploded in the compound and also near our neighbors, the emergency hospital, the Italian NGO. So I was waiting before I flew in. Luckily, things settled down, and this happened around late August. The first flight into Afghanistan. I think everyone knows that. You see all the pictures in the news of people leaving Afghanistan from the Kabul airport, and here we are coming in. I'm not in this plane. These are my colleagues coming in. The first batch of the doctors, the finance co, the HR co, and the project coordinators just arrived. And yeah, so this is from, I think, one of the Taliban or the local news, Twitter news. I was in the next flight in. Okay, so Boost Hospital, supported by MSF, is a very large hospital. On my part, I didn't do due diligence. I didn't read through the JD very clearly. I just know this is not my first mission. I just flew in, and but didn't realize what a big hospital this is. And it's been there for the past 10 years. I would say I just went there for a 5-month posting. I was the ER and MD, ER and ICU MD. This hospital has many facilities, and I'll just quickly run this through with you of what we do over here. This is in our ER. Of course, the ER, our doors, we open to anybody, we take in anybody. And so this is one of the patients. We see a lot of babies and pediatrics coming through our ER doors. This is also part of the ER, one of the treatment rooms. This is the female IPD ward. I forgot to say that this hospital initially was behind 450-bed hospital, but thanks to the pandemic, we reduced it to 300 beds, and it's always over capacity. And it's reminded me, when I came back to work recently, it's reminded me of all the bed blocks and everything is very relevant in Afghanistan as well. And this is one of the female IPDs. Female IPDs, male and females, we have surgical services, medical services, orthopedic services. So it's a really big, busy hospital. This is the NICU, the neonatal ICU unit. There's, as you can see there, I think there's quite a lot of baby cots there, but sometimes we put two babies in a single cot, and there's really no space. Also a very, very busy unit. This is our pediatric ICU, the PICU. I think you can also see we put two children on the bed. Initially, there's concerns about COVID, and then after a while, reality set in, and we just cannot cope. So we just put 2 or 3 kids in a bed, along with their caregivers, as you can see over there. We also have a maternity unit. This maternity unit, very busy. I got a lot of pictures of babies. There's this triplets. There's this one here. There's another one. There's a pair of twins. There's a neonate, premature, another pair of twins, another baby, triplets again, twins. Oh, they're all very cute. I can't pick one, but I was just very amazed that the maternity unit, I think we deliver about 100 babies a day. That is really a lot of babies delivered. I'm not directly involved in the maternity unit. We have my fellow colleagues, the midwives, the gynecologists, obstetricians, neonatologists. Very busy place. We have about 1,300 staff working for us, both MOPH and MMSF. And as you can see, this hospital, I will even say that is in fact, I've been told that I think it's one of the biggest projects in MSF worldwide. And I'm very privileged to be working here and see how it is in Helmand. The next few slides, just want to highlight some things about what I've seen. This is a little child who was dumped by the family. She has tetanus. Sometimes we read the news about families having many children. Sometimes they cannot afford to feed them, and then they would sell their children and things like that. And so we do see a fair amount of baby dumping. They dump the kids in the hospital, and then we have to take care of them, and we have to find some placement for them further down the line. This is just one example. And of course, as you know, the whole society, there's some people, some families a bit more privileged. Like this particular patient, the whole family is here. She has renal failure. She needs dialysis. It's not available anywhere at the moment in Afghanistan. So the family is able to afford some oxygen. As you can see, a large tank there. They bought it from the market, the bazaar nearby. They have a car and a taxi ready to transfer her to another hospital. But in the region, in Helmand, the nearest one, otherwise in Kandahar, there's not a hospital that has dialysis support. So where do they go? Usually they go to Pakistan. So they'll have some connections to find their way to Pakistan. So this is one of the privileged families, I guess, who can find some other means of healthcare, but perhaps not in Afghanistan, but they have to flee the country for it. This is a funny one. This lady, when she first came in with this box, I thought she was delivering something. Actually, inside is just 2 dead babies, her grandchildren. She just didn't realize where to go and what to do. And then when she came in, I guess some miscommunication when we came in through our doors with a box like this. Some of our guards or the watchmen turned her away. She had to walk one big round to find some help. Eventually, she made her way into our ER, but unfortunately, the 2 babies inside there didn't make it. Yeah. So I guess also maybe she's not very aware of what services are available, and also I guess for our watchmen also they're so busy, they just turn her away because they saw this box rather than a little bundle with the babies inside. Throughout my time there, like I said, the busy hospital, we do the clinical work. Also, I've been privileged to try to get, MSF tries to have some sort of a training program for the national staff. So I was very honored and privileged to be able to do that for them over here. Training going on to empower the local staff. They've been here a long time. I'm only there for a short period of time. So it's good to give some training as well. This next picture is not in Lashkargah, but this was in Kunduz. On October the 8th, there was a bombing in the mosque, and these pictures are from Kunduz. They took in a brunt of all the patients, and just want to highlight that still Afghanistan is still very unsafe, and it's very uncertain about the future. And yeah, these are the people in Kunduz donating blood for the patients in the hospital. And I cannot talk about Afghanistan without mentioning about Kunduz Hospital 5 years back when it was bombed, where 14 of our staff tragically died in this tragic incident. Thank you. Just a brief overview of my experience and the MSF Support Hospital in Helmand, Lashkargah. Thanks, guys.
Giselle, I think it is us who should be thanking you for your service up in Afghanistan for those years. Those pictures, each of them spoke 1,000 words, and they were very powerful images, and the story and the narration that you provide are also equally powerful. Thank you. Thank you very much, Sincere. If you've just joined us, we are having a webinar today about the realities of Afghanistan after the Taliban returned to power, not fell, and they returned to power in August of 2021, just about 6 months ago now. And what the Singaporean community, especially the medical community, has done for Afghanistan, not only in the short term, but also going back into history. And I've just looked at some numbers just to share with everyone again. Afghanistan is about 6 times more populous than Singapore, 40 million people in Afghanistan. They're about 1,000 times bigger than Singapore in terms of land area. And Singapore is on a per capita basis about 120 times richer than the average Afghan. And here's a fun fact. Chin Siah mentioned that there were about 100 babies a day born just in Lashkargah Hospital. There are 106 babies born per day in Singapore, every day in Singapore in the year 2020. Just to give everyone a bit of a sense of the similarities and differences between Afghanistan and Singapore. We have one final speaker. Very pleased to introduce Dr. Hakim Young. Hakim, if I may, is a family doctor. He's has an MMed in family medicine. He's done public health, humanitarian, and peace building work in Afghanistan for 18 years, including coordinating the international, group of inter-ethnic young Afghans who are dedicated to a green, equal, and a non-violent world without war. So not only a doctor, but also a community builder. And because of that, or at least partially because of that, Hakim won 2 very big prizes. In 2012, receiving the International FEFA Peace Prize. One of the previous recipients was also Muhammad Yunus, the founder of Grameen Bank in Bangladesh. And in 2017, Hakim received the Singapore Medical Association Merit Award for contributions and social service to communities. Hakim, we're very happy to have you tell us a little bit more about the biopsychosocial health needs and also the collapse of the Afghan healthcare system. Hakim, over to you.
Thank you very much. Thank you for this opportunity. My question for our consideration today is this: in the World Health Organization's holistic framework of biopsychosocial health, how can individual Afghans keep physically, emotionally, and socially healthy while the healthcare system is near collapse? This is a table that gives a crude overview of the Afghan healthcare system over the past 5 decades. When Afghanistan was ruled by monarchies before 1978, they had local tabibs or hakims. That's the name Afghans gave me, Hakim, the local doctor. For the next 4 decades of wars, the system was dysfunctional, with military medics doing the best they could, and many Afghan doctors leaving the country. And then over the next 20 years of the US-NATO-Afghan war on terror, some basic to tertiary services were established, which Tiah Ling spoke of, though quite unsustainably foreign-funded and NGO-run. Contrary to what we hear in the news, even before the US negotiated return of Taliban 2.0, the system was already near collapse. So if you lived in Afghanistan over the past 5 decades, how would you survive an injury or an illness? Well, for a major injury in war, you would survive by chance. If you were lucky to have someone nearby to give first aid and stop the bleeding, and then get you to some expert help in time, like Lim Chin Siah at Doctors Without Borders Hospital, you may have a chance to survive. But if Chin Siah was in Singapore sharing at a webinar like this, you may unfortunately then become one of the more than 2 million deaths in the Afghan war over these past decades. That is, you would not survive. What if you or your child only had a minor illness? These are children in a village in rural Bamiyan province where I did public health education programs. I remember at least one family in this village who had lost the child to a minor problem of diarrhea. And it challenged me that this was happening while I was there conducting health education lessons. In another village, which was my home village for 7 years, my neighbor who had a sore throat was told by doctors that her enlarged tonsils were life-threatening. She was told that her big tonsils would close her throat and make her throat blind, and she could suffocate to death. Urgent tonsillectomy was recommended. It created such a scare in the village that I had a long queue of neighbors at my door, seeing me for life-threatening sore throat, panicking and afraid that they would suffocate in their sleep. Haraba was the name of the village, meaning the ruins, perhaps where healthcare was also still in ruins. I couldn't help but write a short story called The Tonsil Blindness of Haraba. And what if you had a major illness, like my village neighbor Shams on the left, whom I clinically diagnosed as having lymphoma? Shams couldn't get a definitive diagnosis or treatment in Afghanistan and couldn't afford a trip to Pakistan or Iran. In his last weeks of life, Shams had asked his family for forgiveness for groaning in pain. There was a village graveyard marked out specially for children, but it was already full. So when Shams passed away, he was buried at the edge of the cemetery near a ditch. We can therefore understand that Afghan services for emotional and social healthcare have also been inadequate. It is estimated that 70% of Afghans have psychological challenges, understandably so in wartime. Interestingly, in terms of emotional health, a Gallup Emotions poll in 2012 ranked Singaporeans as the least emotionally positive people in the world, even less positive than war-ravaged Afghans. Certainly food for thought and research for Singapore's emotional healthcare providers. Looking at Afghanistan's top risk factors for death and disability in 2019, taken from a Lancet study, it's clear these risk factors can be addressed through holistic health education and care. By that, I mean practical, preventative health education for every Afghan on how to stay physically, emotionally, and socially healthy every day. This has always been important anywhere in the world, so it's even more crucial in a near-collapsed health system. For physical health, we can educate on healthy diets and nutrition for chronic diseases like in Singapore, masks for air pollution, the number 2 risk factor, and washing and sanitation for acute infectious diseases. These are life-saving measures. As for emotional and social health, I hope that there will eventually be concrete public health care measures for the risk factors. For Afghans, I encourage them to care for the emotional health by brushing their emotions every day. I myself had experienced merely a fraction of their trauma, and like them, I found that daily emotional health care was essential not only for my well-being, but for my survival too. For social health, Afghans can preserve the natural social connections and support in Afghan culture. They should avoid the hyper-individualistic, urbanized, and isolated societies of Singapore and the developed world. I'd like to end off with a lesson I learned from Afghans and this Italian international emergency NGO, which runs hospitals just like Doctors Without Borders. Emergency NGO has a foundational pillar of advocating for the abolition of war. I myself have come to consider the abolition of war as my personal humanitarian and medical responsibility. In order for humans to stay alive, healthy, and well. I mean, if Singapore had 5 decades of war with up to 52 NATO countries backing different groups in Ang Mo Kio or Jurong, and the occasional bombing of NUH or SGH against Geneva Conventions, good luck to our healthcare systems. In short, I suggest that especially while Afghans are not able to rely on a collapsed healthcare system, they need to individually and collectively care for the holistic health of physical, emotional, and social well-being every day. They can also work towards the abolition of war by not participating in it. And as Albert Einstein campaigned during World War II, not even to participate as a soldier. We can certainly support them to do this. So thank you very much for your time.
Thank you, Hakim. Love the fact that you were called Hakim, and it just happens to be also the name of well, the doctors in the local customs in Afghanistan. I think that's a beautiful twist to it. Hakim and Chin Siah as well as Tiah Ling, thank you so much for sharing your thoughts. What Tiah Ling has mentioned to us was the hospital management and the growth of hospitals within Afghanistan about 10 years ago. Chin Siah shared his stories about working in Lashkargah for the last 5 months since the Taliban came into power, and lots of pictures that brought us to the field and to the ground, sharing experiences through his eyes. And what Hakim gave us was a more system view about the healthcare system in Afghanistan and its collapse, and I guess our moral responsibility to help our friends and brothers and sisters in Afghanistan. Thank you so much, Tiah Ling and Chin Siah and Hakim, for your sharing. Now, ladies and gentlemen, we have about 15-20 minutes or so worth of questions, so we'll try to finish at the top of the hour. You are very welcome to ask any questions that you have. You can ask in 3 ways. The first way is if you can just raise your virtual hand, very happy to call you, and you can verbalize your question. Number 2, you can type it in the chat box. Number 3, you can send me a private message if you want to remain anonymous. I offer you these 3 choices for you to ask any questions that you want, and we really encourage them. I'm sure the panelists would love to interact with you. So please ask any questions that you want. Let me kick things off though. Tiah Ling and Chin Siah and Hakim, maybe we'll go reverse order. So it'll be Hakim for quick thoughts, and then Chin Siah and Tiah Ling for quick thoughts on the same question. The 3 of you are medical doctors. Health is important, and health is very healthcare driven too. But health is also political, social, economic, things which are outside of a hospital, outside of, I guess, a medical practitioner's hands and control. My question, therefore, is, what can health professionals do? Because most of us listening in today are health professionals. What can health professionals listening in today do to support the political, economic, social, shall we say, the non-healthcare elements of health in Afghanistan? Maybe just to put you on the spot a little bit, Hakim, maybe we can listen to you first. Over to you.
Yeah, well, thank you very much. I think that at the personal level, we can try to do things where we are in Singapore to advocate for a climate where healthcare is accessible and affordable for all. In the instance of political or economic policies that deprive Singaporeans or Afghans or anyone else across the world without borders, right? Then I think we can speak out as professionals to say that from the medical perspective of being a healthy human being, those political or economic barriers are artificial and should be mitigated or minimized. Thank you.
Thank you, Hakim. What about you, Chin Siah? What do you think about that?
For me, I have more questions than answers to your question. It's really very difficult when I was in the ground. It's really quite dire. As a medical doctor, medical team, we can't do much, honestly. I think we have to rely on health policies and government and politics to help try to spur some change to stop all this. Otherwise, it could go into a very vicious cycle. An example is like, I think like Tiah Ling showed us all the healthcare system of Afghanistan, the CHCs and all that. It really collapsed all around our hospital. So we're the only hospital around. And then one of my medical coordinators also made a good point that should we expand our services or not in Lashkargah? But after all discussion, we are leaning towards not expanding the services. We are getting too big. And it's a very interesting point that you mentioned that if we were to expand, we'd hire more healthcare professionals in Afghanistan, but there's none. Everyone is working for us already. We deprive other regions of healthcare expertise. So it's very, very difficult. I got no answers to this, but I think we have to advocate for it, and like Hakim said, to raise awareness of the dire situation in Afghanistan at the moment.
Thank you, Chin Siah. Tiah Ling?
Oh, very tough. I guess it's hard to, if we are not in it, it's hard to actually experience what it really feels like. But we can actually empathize at least the challenges that they have in terms of the political security and all these things. But I guess what we can do from here at least is for our own mindset first. If we do not despair, I guess we can do our little bit. It might not be a physical contribution, being physically there to do the medical work that they need, but even if it was mentally or emotional support that we can give friends that we know they are there to go through what they are going through now, that's for the short term. And like Chin Siah said, I have no answer for the long term thing. But it is, I think it starts at least with the empathy and the mindset that not no matter how despair the situation, is not zero hope lah, I guess.
Mm. Well, that's really encouraging to hear that we as in everyone listening in, and certainly the three of you, do what you can where you are with what you have. And the situation is not as bleak as we think it is. Thank you, Hakim and Tiah Ling and Chin Siah. There are some questions that are coming in the chat group, so maybe I'll just take two of them as they've come in. The first one's from Jeremy. Jeremy's just building on to the first question that we've answered. And let me just open this up to anyone here. I would love to hear from the three of you. What do you think concerned Singapore residents can do beyond donating money? In particular, given that NUS, for example, has a global health program, or maybe even NTU, I'm not certain about that. What do you think concerned Singaporean residents can do beyond donating money, in particular, given that NUS at least has a global health program? Can I open the floor to any one of you?
Okay, maybe just a quick mention. Also, I think education is really important. Okay, I mean, medical education, perhaps. In my little experience and what I've seen, we had to hire just one locum doctor to cover our medical needs in the hospital. A midwife. It was so difficult to hire a midwife. Many applicants. Female medical professionals, but we realized that the quality of education is really, really poor. And I know, I'm just thinking about all the 100 births that we have a day in the future. They need to be educated to bring the country, to elevate the country further. This may not answer Jeremy's question directly, but perhaps some investment in the future, in the big picture, in education, medical education, perhaps, because all the senior doctors probably in Kabul and all the other cases probably left the country, I would assume. So I think there's a big void and a big gap here. I think that this can potentially be addressed in the future to help. My 2 cents.
Thank you. What about Tiah Ling and then to Hakim?
I guess also looking at Jeremy's question, just to clarify that, do you mean to say do something more through the global health programs in your universities?
Thank you, Tiah Ling. It's really to try to figure out where the contours are, because Singapore stepping up to be a more responsible global citizen. But our default position seems to be to put out $50,000 through the Red Cross every time there's any disaster. And now that Singapore is stepping up, NUS, Buchan US, NTU all have global health programs. They're hosting the Global Health Security Conference in July this year. Are there things that we should be thinking about doing? And I'm not saying whether it should be done as Singapore, as a university, but just glad for all of your thoughts. Thank you.
Yeah, I guess the action of actually donating is probably the easiest in a way for a lot of us. If we cannot afford the time or the effort to actually participate in the work. So I guess donating is the easiest, but my personal view is if there's anyone who would like to actually contribute meaningfully to any of these developing settings that require assistance, like you said, not just from Singapore, from external existence. One way, I guess, to look at it, it's focus on the development part of the development instead of acute disaster sort of management thing. That means you fly in, fly out for 2 weeks and then that's it. But if we could get involved in longer term projects, 3 to 5 years, rebuilding development in any way, whether it's medical, whether it's to a curriculum, that might be one way to contribute. And this goes beyond healthcare professionals, I guess, teachers, engineers, anybody, in terms of rebuilding communities. There's, I guess, one way that people could start looking at instead of looking purely at donating money.
a great insight, Tiah Ling. Thank you very much. That well, in the acute phase, we certainly need doctors, but in the long-term rebuilding phase, teachers, social scientists, economists, lawyers, engineers, all sorts of disciplines, really, because health isn't only medical; it's also very social. Thank you for these answers. Jeremy, over to you if you have any follow-ups.
Nope, there's nothing further. Thank you very much.
Thank you, Jeremy. There's also a separate question more directly for Tiah Ling. It's from Chi Siang or Liao Chi Siang, if I may. Tiah Ling, Chi Siang's question is, what are the reasons that the contracts that you mentioned only last for 3 months? Over to you, Tiah Ling.
Yeah, so it's hard to know exactly why it only lasts for 3 months, but in that context, different funders have different priorities, and the deliverables are different, and the programs that they fund are also slightly different. So it's a variety of aspects that funders take into account. So, and one of the contributing factor to these short-term contracts is the insecurity. I think to some extent they want to, there's a sense of taking it step by step, a bit by a bit by a bit. If you survive 3 months, you talk about it for another 3 months. I think that's something that in a secure place like Singapore, we might not experience it so much. But this is only what I hear from the locals that we have worked with, and from based on what they understand the situation is. I hope that answers the question.
It appears to have a cheese. Unless Chi Siang, would you like to say verbalize a follow-up? Over to you, Chi Siang, if at all.
No, that's all. Thank you.
Thank you.
Thank you. Ladies and gentlemen, we've got time for maybe another round of questions or any interventions from anyone.
Can I say something to Jeremy's question earlier? Sorry.
Oh, of course, Hakim, please go on. Sorry, I should have called you. My mistake. Please go on.
No problem. I thought and I wanted to affirm Chin Siah and Tiah Ling's response about training and development of Afghan doctors and nurses and medical personnel. And from my grassroots perspective, it's better to train them in Afghanistan, so send people there to train them there rather than here. And then for healthcare systems as a whole, which is such a big issue globally, whether countries are able, societies are able to set up sustainable systems. If NUS or other universities here have discussions and forums to exchange ideas, not as a country, but as a human species trying to figure out what is sustainable for our healthcare for people in general. I think that would help, because from what I've read about the discussion of healthcare systems in Afghanistan, it was really quite Western biased, and a lot of it was not sustainable from the beginning. As we see now, quite collapsed. And then the third area is something that we can learn from Afghans. And I refer to that in one of my slides about psychological or emotional health. They hardly have access to any of the psychiatric or drugs, medicines or professional care, but they remain very resilient despite 5 decades of war. There's a lot to learn from that or to research on, and if we can collaborate with them, I'll be happy to get involved. Thank you.
Hakim, thank you very much for this great answer. Ladies and gentlemen, we've got about 5 minutes left. On paper, I'm supposed to sum up. So here's a quick summary, and then I want to end with we've got a difficult question for our panelists, okay? And just to give them a bit of time to think about this, the question is, Afghanistan is so far away from Singapore. Why should we care? And that's a difficult question, and I want to put this for the panelists with a bit of advance notice. But let me very briefly run through a bit of a summary so far. firstly, we can speak out as professionals in Singapore and to be in solidarity with our brothers and sisters in Afghanistan. Secondly, think about how we can use the global health programs and I guess the stature of NUS and the reputation of Singapore as ways to help our brothers and sisters in Afghanistan. Think about how we can use our programs to help them. Number three, don't only think about health in the short term, think about development in the long term. Send teachers and economists and people to help build the country, not just focus on hospitals. Fourthly, help them there instead of bring them out. And fifthly, learn from Afghans, for example, the resilience that they demonstrate. That's a brief summary, a recap of the pearls of wisdom that Tiah Ling and Chin Siah and Hakim have shared. But if I may, maybe a few last words from each of the panelists, and we'll invert the order a little bit and perhaps ask Chin Siah to go first, and then Hakim, and then Tiah Ling. Afghanistan is so far away. The three of you cared. Why should the rest of us care? Chin Siah, over to you.
It's a difficult question, like you said. You gave us heads up. I would say, why not? Why shouldn't we care? For me personally, the way MSF works is like there's a project or crisis, an emergency, and your job scope fits this. My job scope, I'm an emergency and critical care physician. It fits exactly. Why not go to help out the citizens of Afghanistan? And I've been there before, 5 years back in Kunduz, and I really liked it over there. Like Hakim said, I wanted to echo what he said. The people there are really, really, really resilient. You talk to them over lunch or dinner, over tea. You talk about the children, and then most of them, I don't know, Hakim, about you, but how many kids you have? 5. 2 died. Oh, it's like, by the way, two of my kids died before. It's like, and then the wife's pregnant with another kid. They're just very resilient, and they're still very positive. There's a lot of things learned from them. I really admire them in that sense. And the media always plays about this Taliban, the West, good and bad, like that. But someone told me before that one man's Red Bull is another man's freedom fighter. It just depends on your perception and and how they help you, basically. I'm not sure if I answered you directly, but this is just my...
You have. It's a very profound answer.
Thank you.
Thank you, Chin Siah. Let us turn to Hakim for any final thoughts, and then Tiah Ling to close us out. Hakim, over.
Yeah, we should care because we are human beings and we belong to the same community. And it doesn't matter whether the human being is far away or nearby or within Singapore. I think when we care for anybody, we care for everybody. So thank you.
Another great answer. Thank you, Hakim. Tiah Ling, over to you.
Yeah, I'll simply echo what Chin Siah and Hakim has said. Totally agree. But I think the fact that all of us are here actually already showed that you somehow in your own mind, own heart, you have found a reason to care. So I think carry that forth then.
Wonderful answers. Thank you very much, everyone. In the 20 seconds or so we have left, I'll record my thanks to the 3 panelists and to Elisa for really masterminding the entire topic and the organization of it. Thank you very much, Elisa. And allow me to end with a word from Afghanistan. It means God be with you, or in God's protection you go. Khoda Hafiz to everyone. Thank you very much again, everyone, and to our 3 panelists, and wishing you all the best. Thank you. Bye-bye.
Thank you very much. Bye-bye.